Alec Lewis.
Thank you. Section 6, which would establish PLA codes or precision pricing within the biomarker testing program. This is important legislation enacted at Connecticut that is fairly new. It is now fully effective for both Medicaid and private commercial insurance as of January 1st. It kicked in on the private commercial side. But I wanted to respond specifically to the commissioner's testimony. And while I respect it, I wanted to respectfully work to refute some of the points that were made in the commissioner's response. It's their response is on page 25 of, and I want to go through that very quickly, but relatively speaking, line by line. So, respectfully, I would offer to the Connecticut Department of Social Services here that they are continuing to be an outlier in not adopting PLA code price for their Medicaid fee schedule. Most of the biomarker states have moved in this direction, and Connecticut is now one of only a handful of states that has not adopted PLA codes for biomarker testing on their Medicaid fee schedule. And this is a problem because coverage without codes is in reality coverage in name only. PLA codes are critical for modern biomarker tests, and most states have recognized this. It ensures fair and consistent reimbursement. It enables the enforcement of the existing biomarker testing law in Connecticut. And I think most importantly for real people here in this great state, it prevents delays in cancer care. And of course, we know that for anyone suffering from cancer, time is essential. It keeps Medicaid aligned with innovation nationally. And the 60-day timeline that's in the legislation comes directly from legislation that was just signed into law today in Mississippi, which is now part of their biomarker statute. So this is not new, and this is a direction that most states, again, are moving in. I also wanted to kind of go through a couple other pieces that the commissioner mentioned. PLA codes do not determine coverage, they enable accuracy. And these are not unvetted tests. PLA codes are issued by the American Medical Association, which the commissioner's testimony does not mention. And I wanted to mention that for this committee. The PLA codes are, in fact, from the American Medical Association. And clinical value ultimately is driven by guidelines, not billing codes. Clinical decisions are made by modern medicine. They're not made by what type of billing code a test has. And PLA codes are unique. They're precise, they're specific, as opposed to catch-all CPT codes or other types of miscellaneous codes. This is an opportunity for the Medicaid program to invest in real accountability. Finally, I would just recognize that PLA codes align Medicaid with modern medicine. There's no new cost mandates here. This is simply about helping Connecticut to properly implement its existing biomarker law. Thank you so much, and I welcome any questions you might have.
Thank you. Yeah, the last sentence of the commissioner's testimony on this section says that it's not included in the governor's budget, and I'm just wondering, um, in your view, how much would that? What is the cost associated with this?
I would respectfully disagree with that, with the commissioner's assessment. The costs should be fairly minimal. These PLA codes, I can't speak for every type of genetic testing company, but the PLA codes are tied to a specific test. So most Medicaid units already have these codes. They've priced them on their fee schedule. It would really be a one-time essentially a data entry project to put the codes within the system. And then once they're initially in there, it would be periodically updating the Medicaid fee schedule for new PLA codes as a test went through the approval process and was vetted by the Medicaid program. So there's no significant fiscal cost. So I would respectfully disagree with the assessment made in the commissioner's testimony.
Thank you, Madam Chair. So, when you say Connecticut is an outlier and other states have done this, can you talk about that?
Sure. So most biomarker states, and when I say that, I mean states that have passed and enacted the biomarker testing coverage law. That's a national model legislation through NCOIL that's been broadly supported by the American Cancer Society. Connecticut is now only one of a handful of states, I believe one of 4 states that currently has not put PLA codes on its fee schedule in terms of pricing. 2 of those 4 states have either approved using PLA codes and are in the transition or are reviewing. So some other biomarker states, just to help you get a national scope of this, that have used PLA codes on their Medicaid fee schedule include Illinois, Pennsylvania, Florida, Minnesota, New Jersey, Georgia, Kentucky, Indiana, Maryland, Iowa, California, Arizona, Colorado, and New Mexico, and Oklahoma. It's most of those states. So this is very important because we don't want Connecticut to fall behind with biomarker compliance. And Connecticut really has an opportunity to get it ahead of this and in front of this and make sure that the biomarker testing promise is made real for all residents of the state of Connecticut.
And finally, what does PLA stand for?
Stands for Proprietary Laboratory Analyses Codes, and they're a particular type of billing code that have been developed and approved by the American Medical Association.
Okay, thank you.
Thank you.
Go ahead.
Thank you so much, Madam Chair. And thank you for your testimony. Just quickly, could we just take the codes from the other states, or what about the Medicare program?
Yes,
Does the Medicare program actually have are they utilizing these
yeah.
codes? And how about in the insurance industry? Just a little bit of a summary for each one of those.
Sure, great question. So I can't speak again for every single genetic testing company. We have tests that have been approved by Medicare Advantage and have what's the Medicare LCD coverage determination. It's one of several pieces of criteria within the biomarker law that is meant to trigger coverage under the biomarker law as is. So yes, these billing codes do not need to be created out of the blue in Connecticut. They already exist. The majority of states already use them. Medicare Advantage uses them. We just need the Connecticut Department of Social Services to recognize them and accordingly update the fee schedule. And again, if you hear from any other genetic testing company, they will likely tell you the same thing. These codes are specific, they're proprietary, and they offer immense opportunity for the state to really implement the biomarker law correctly and effectively. And every economic study that we continue to look at shows that the biomarker testing law is such an enormous opportunity for both Medicaid and private insurance to save money. And to your question about the private insurance, I hope I'm answering that through this statement. Private insurance typically, again, does recognize PLA codes because it's really just a best billing practice, and it helps providers ultimately bill, whether it's private insurance or Medicaid, properly.
And just to follow up quickly on the Medicare aspect, you said Advantage Plan, which is the privatized version of the Medicare program, but also how about Medicare fee-for-service and the supplemental programs? Medicare in general,
So
that's federal and it's national.
I want to be just very careful and specific to how I respond to your question. So I cannot speak again for every type of genetic testing company. We have 2 specific tests, Signatera, which is our flagship cancer care test, and then Prospera, which is our flagship organ health test, which has the Medicare local coverage determination status. So that's an existing process that goes through the clinical review and vetting. And the national model biomarker legislation recognizes that a test that has gone through that process and has that designation should be qualified for coverage under the biomarker law. FDA approvals and designations are another one. And that's another issue where I would sort of respectfully point holes at the commissioner's testimony. There's a very kind of not obsession, I would say, but just a very particular focus on the FDA piece. And the FDA approval or being in that process is only one of several eligibility criteria that's in existing Connecticut law. And again, Connecticut's biomarker law is based on the national NCOIL model legislation that includes all those criteria, which includes FDA approval or designation, CMS determinations, clinical evidence, or peer-reviewed studies. It's really meant to give actually DSS broad ability to assess the clinical validity of tests as is. I think they have concerns on that. I would argue they already have that authority, and the PLA codes aren't related to that at all. It's really a red herring, and we're simply just trying to have precision pricing for precision medicine. And ultimately, for accountability, you have precision spending. You have real numbers that point to exactly how much money is being spent on what tests.
Just one more quick question, and that would be, have you followed up to see the analysis in states where they use the biomarker testing analysis versus the states that don't, and the pricing?
Yes, I mean states have some ability to have. I mean, look, in a perfect world, every state would price these tests to 100% of the Medicare rate. But reasonably, states have the ability to price at what they see fit. Florida recently just, I think of Florida as a good example. They priced, I want to say, roughly 50% on their Medicaid fee schedule to what the Medicare Advantage, the Medicare rate is, excuse me. Ultimately, we know it's a long-term process to implement this. The biomarker law is still fairly new nationally. I think the earliest states that have done it only go back a few years ago. So really, we just want to make sure Connecticut has the opportunity to get it right and ultimately helps people from, particularly with cancer, but when we think of cancer care, women's health and organ health and all the opportunities that exist with biomarker testing to just help ultimately improve real health care outcomes and save lives and help families. We want Connecticut to be able to realize that.
Great. Thank you so much, Madam Chair.
Very welcome. Rep. Fail?
Thank you, Madam Chair. Make this sweet. So you support Section 6?
Yes, absolutely. We
Okay,
do.
thank you. There was a lot, yeah. And now I know what a PLA is too, so great.
Yeah, you probably know more about it than you ever wanted or
Yeah.
needed to
No,
know.
it's all good. I learned a lot today so far.
Thank
Any
you,
other questions?
Representative. No, that's it. Thank you, sir.
Okay. Well, thank you all so much for your time and your attention and your questions.
Absolutely. Thanks for joining us today.